Welcome back to another episode of Single Payer Radio. Single Payer Radio is a project of Kentuckians for Single Payer Healthcare. We are an affiliate of the Kentucky chapter of Physicians for a National Health Program. Single Payer Radio is part of the public affairs programming here at Forward Radio. We aim to raise awareness about the dire health and financial consequences of the current profit-driven healthcare system. I'm Mark McKinley, a volunteer with Kentuckians for Single Payer Healthcare and a sustaining member of Forward Radio. Become part of the Forward Radio community. You can go to forwardradio.org. The views and opinions expressed here on Single Payer Radio are those of the speakers and not the station. If you have comments about the show or would like to share your healthcare story, please send a note to Kay Tillow. Kay is our chairperson there at Kentuckians for Single Payer Healthcare. Kay's email address is nursepo@aol.com. That's nursepo@aol.com. We're recording today's program on April 23rd in our Hayburn studio. Hope everybody got a chance to spend some time outdoors yesterday and celebrate Mother Earth on Earth Day. Dr. Michael Flynn and Dr. Eugene Shively are back to continue their series of discussions about our healthcare system. Both are retired surgeons with about 100 years of medical practice between them. Dr. Flynn's practice was primarily in urban areas, and Dr. Shively's practice was primarily in the rural part of Kentucky. Both Dr. Shively and Dr. Flynn are emeritus professors at the University of Louisville's Department of Surgery. On today's program, we'll be discussing some of the aspects of the pandemic crisis, and if we have time, we'll get into the issue of access under our current system. Doctors, welcome.
Thank you.
Thank you. Good to be here.
Okay. Mike, do you want to start us off with the discussion?
Let me begin with the disclaimer that these views that will be expressed by me today are my personal views and do not in any way reflect the views of the Department of Surgery or the University of Louisville.
Okay, good deal.
My views are the same. They're my own. They don't reflect the Department of Surgery at the University of Louisville, nor do they reflect the Taylor Regional Hospital. I'd like to also add that if you don't agree with what we say, email us and we'll look at the data and try to correct it. This is a moving target and is moving very rapidly with the current pandemic, and I think there's a lot we can learn from this in the future, particularly the cost of medicine and how we can correct it.
Okay, thank you, Dr. Shively.
Yeah, so let me sort of set the pandemic table, if you like. In the first 20 years of this century, we've experienced 4 pandemics. The SARS, severe acute respiratory syndrome, 2002, began in China. 8,000 infected worldwide with 770 deaths, which is a relatively small issue compared to what's going on today. 2009, 2010, the swine flu, H1N1 virus, transmission from pigs to humans, and mostly involved Asia. MERS, the Middle East Respiratory Syndrome, 2012. Saudi Arabia involved 27 countries, was a coronavirus, and again was a zoonotic transfer of the virus from animals to humans. And then there's the Ebola virus, which I guess you could call a mini pandemic, this in 2014, where this involved mostly involved Africa, and again it was an animal to human virus transfer. So with that table setting, we come to the issue of the response of our government to this issue. And the reason I wanted to mention that was to get into a couple of other issues that we can discuss in more detail. But just let me start off with the briefing that was given to the incoming administration by the outgoing administration in January of 2017, a week or two before the inauguration. And this was a transition exercise. And this transition process was not something invented by the Obama administration. It was something that was initiated by the second Bush administration in order to transfer a lot of the knowledge base from that administration to the Obama administration. And then they attempted to do the same thing to the current administration. And the scenario that was presented was a strain of influenza. At that time, they were calling it H9N2. And this came from Asia, swept through the continents, became a global issue, it reached the United States, and all of the issues that we're dealing with today and have not been managed very well, they were told about. As in this tabletop scenario.
And that was back in 2017.
January 2017. And a lot of top administrative individuals were there, including Wilbur Ross, Rick Perry, Betsy DeVos, and Sean Spicer. And the accounts that I've read about this, I've read a number of them, all pretty much said the same thing. The audience was not interested. They were bored, and it just was something that in their whatever mindset they were in, just simply weren't interested in hearing these things.
Dr. Shively?
Well, one of the reasons that the previous epidemics had not spread like the one now is if you got sick, like with Ebola, then you were really sick right from the beginning and you didn't have time to travel or spread it. That was true with SARS and the other epidemics. There were some countries who were really prepared for this. Singapore, for example, had experienced the first SARS. They were prepared, and as soon as the epidemic started in China, they started testing people. I heard a testimonial just a few days ago, and this lady is a cardiologist. She worked in Singapore, also had affiliation with Duke University, and the government tested him, and before he could get home, they had called him on his cell phone. They quarantined the whole family. They even went to the point that they called him twice a day, and he had to prove on over the iPhone that he was actually there. And so they tested people, they checked them out, and made sure that they were quarantined. And so they were able to really decrease the number of people who had SARS and also decrease the number of people who died. They did the same thing in Taiwan, in South Korea, and the Germans have done the same thing. One of the reasons that they were so successful for the government doing this is the governments were very strict and the people trusted the government. In Germany, for example, the prime minister has a PhD in physical chemistry. And so Angela Merkel understood the science, and she got people tested, and they had much fewer cases than Italy and the United States.
Yeah, these are examples of governmental responsibility and competence, and people in the government recognizing the issues and dealing with it. Again, to go back to this briefing that was given in 2017, Sean Spicer, who was the Trump's first White House secretary,
Press secretary.
press secretary, yeah, thank you, made a comment that this was all very theoretical, and he made the comment that in real life things are never as simple as what's presented on tabletop exercises. Now, the military do these tabletop exercises. They're called war games, and they've done these literally for centuries. And the game is to learn how to fight a war. I was in the Navy in the reserves for 20 years, 18 years as a reservist and 20 years in active duty. In the late 1980s, I went to Norway for a couple of these NATO training exercises. Before we went on the training exercise, we went to NAB, the Naval Amphibious Base in Little Creek, which is on the edge of Norfolk in Virginia, and went through a training exercise. And so this is a standard military process gone on, for years and years and years and decades and centuries. And it just gives you an idea of how arrogant and how unprepared the government was to deal with this. They just weren't interested in learning that, paying attention to these warnings, and they were, I guess, either unaware or just didn't care about the issues of all these other pandemics that had occurred in the first 20 years of this century.
Dr. Shively, do you think they were looking to get a head start on some of their agenda as opposed to taking care of some of the items that they weren't elected on?
I'm not sure how they were thinking. I don't think anybody could foresee an epidemic like this.
Agreed.
Although the people in Taiwan and Singapore and South Korea, they had been affected in the past and they were prepared. Actually, in Singapore, they had just finished a new hospital, a 300-bed hospital to take care of epidemics like this. And they had central medicine. It wasn't divided up like it is in this country, where we have no one really in control. We've got private insurance, for-profit insurance, different hospital systems. None of that is correlated. Even Medicare, except for a few regulations, doesn't have much control. And so when the epidemic started, we didn't have anyone in control. In my opinion, the federal government should have taken over. There should have been a central command, and the central command should have been run by scientists who are experts in this, doctors who are epidemiologists and infectious disease, and then they should have controlled the whole system rather than having 50 different states with 50 different governors who are competing for supplies, etc.
Yes, sir, Mike.
Gene,
Flynn.
Gene, I absolutely agree, and that you've let me get into what my next issue is going to be. In 2016, the Obama administration established a Directorate for Global Health Security and Biodefense at the National Security Council. And it was filled with just those people that you mentioned. And it was their job was to essentially function as a smoke alarm, to be out there, doing intelligence, figuring out what was coming on, and put together a plan to prepare for this issue. And that was disbanded in 2018. And some people were moved into one department or another department. It's kind of hard to figure out, what the thinking was, where it all went. One description that I read suggested it would be like taking the fire department and moving them into the police department, so that if you called the fire department because you had a fire, a police car would show up with 2 firefighters in the back seat. So again, you got to wonder what. Again, your head wants to explode when you think about the astonishing degree of governmental incompetence in the issue of having been warned about this, in the background of having all of these pandemics, and the way this was just ignored and mismanaged.
Do you think part of that was some thinking from the top of mistrust of the experts, what may have been considered, well, this is another arm of the deep state, where experts were not valued?
Oh, absolutely. I mean, I think there's a clear view in the current administration in Washington of basically, an anti-intellectual, anti-scientific approach. I mean, the other issue is that most of the adults are gone. McMaster's gone, Kelly's gone, Tillerson. I didn't always have a great, but he was a man who could tell truth to power and had a lot of experience in the world. All these people are gone. So what you're left with are a bunch of facilitators and yes men who simply go along with whatever they're told. And so you've got this combination of this anti-scientific attitude plus a government filled with people who are not willing to make some kind of statement about whether something is appropriate or something should be investigated or followed or how things should be managed.
One of the other really huge mistakes is defunding the World Health Organization. Now, the World Health Organization doesn't really affect us in the United States that closely, but it's the only organization that I know of that can have some influence around the world. For example, I've been in West Africa on several occasions, and they don't have any medical care. It's very primitive except for some of the mission hospitals. And if we have an epidemic like the Ebola virus, they were the only people who could come and help out. And if it hadn't been for them, we could have had a huge problem. But they were able, with help, were able to control it. And so without the World Health Organization, we could have another global epidemic, and there's going to be no one to intervene and to provide care. And recommendations.
Dr. Flynn?
Yeah, to its credit, the United States Army sent a unit over there, one of the medical units, to set up a field hospital and help in the management of that. And they've got these specialized units. And the only other comment I might make: did you see the fundraiser that was actually organized by Lady Gaga? It was not a person I've ever got a lot of. It was really, really very good, and it raised $100 million for the World Health Organization.
Wow, that's incredible.
Yes, it was. It was.
Yeah, I did catch a couple. We turned it on, and
Yeah.
there's members of the Stones.
They were.
Getting their,
Bill Gates. Now, on the other hand, some of our where I don't see the Koch brothers on there. I don't know where Sheldon Adelson was. I mean, there's a lot of well-to-do people in this country are just sort of hanging out, hiding in their desks instead of stepping forward and trying to provide some kind of leadership or financial support, and when they can certainly well afford it.
Bill Gates warned us of this. I think it was in 2016. He gave several lectures, and he's been very concerned about this and developed an interest. And most of the people ignored him.
right. Well, at least most of the people from some persuasions, I guess. Could we kind of move from the big picture, DC, and the context that you guys have given us as far as some history, to what are you seeing as far as who's doing, as far as governors doing well versus some actions that are being taken that concern you? Why don't we start here in Kentucky?
I think our governor's done an incredible job, and he's going to start gradually opening things in the next few weeks. He announced yesterday that we can probably start doing a few elective outpatient procedures. We can start doing mammograms and things that are elective, but he's going to gradually extend that, and he has physicians, epidemiologists who are advising him.
And I agree, and I think the mayor of Louisville has also done an excellent job. Now, Governor Beshear was out way in front of this, and it was in early March. At the same time that the president was in front of a podium saying that we only had 15 cases and this was going to magically disappear. There's another kind of wrinkle here, if I could take
Yes,
us off
please.
in a similar but different direction. I don't know how familiar you are. I've got this Navy thing. The USS Theodore Roosevelt.
Yes, sir. Yes, sir.
Atomic powered aircraft carrier was in the Pacific, and the captain was concerned about the coronavirus issue on an aircraft carrier. Now, I've only been on one aircraft carrier, and it was a World War II aircraft carrier, but there's no social distancing in an aircraft carrier. You've got 5,000 people packed into a big steel massive machine. And he sent a letter that went to a number of different sources, and it was eventually published by the San Francisco Chronicle, so it came out in the public. And the way I understand it, because of that, They ended up in Guam. Captain Crozier was relieved of command by the acting, somebody who has not gone through some kind of Senate review process, the acting Secretary of the Navy. When he left the ship, his name was chanted and he was cheered by the crew. The acting Secretary of the Navy, a fellow named Thomas Modly, he was the second acting Secretary of the Navy. It's another issue. Flew to Guam. He went to the pier side. He didn't have the intestinal fortitude to go on the ship, and he gave a tone-deaf speech to the crew. And interesting to hear some of the comments that the crew made about the speech are words that we won't want to use here because Mark will probably cut me off.
FCC.
And he resigned the next day, and I hope he spends the rest of his life collecting garbage. Now, the healthcare issue is another aspect of this. There are a little under 5,000 sailors. Most of them were taken off. They had to leave a skeleton crew on there to run. It's an atomic-powered submarine, aircraft carrier. 98% of the crew were tested. 600 of them were positive, and the majority of them, 60%, were totally asymptomatic. And, I mean, it's an interesting little study into how much of this condition is not recognized and how important it is to know that before you start opening things up. And as Gene mentioned, the governor has really done a very careful, very sensible job and has got a plan of not turning the switch on, but slowly turning the faucet on and just letting a little bit out at the time and kind of gauging it about as how it happens. And again, when you think about 60% of these sailors were totally asymptomatic.
Well, you know, there was recently a scientist who was fired because he was looking into chloroquine and hydrochloroquine as a treatment, and most of the science shows that it's not effective. And he was trying to develop other means of doing research, and he was essentially fired because of that.
Yes, sir. But let me just take a break and say that you're listening to Single Payer Radio on WFMP 106.5 Forward Radio with our guest, Dr. Michael Flynn and Dr. Eugene Shively. Dr. Flynn, did you want to continue?
Well, no, I wanted to sort of, again, yes, I do, but maybe taking a little shift to the left or the right, depending upon which way this goes, and mention that at U of L, in collaboration with Baptist and Norton's, these are the three major healthcare organizations in the city, are collaborating on a study, COVID-19 plasma study, in which they are taking people who have either recovered or have tested positive without the illness, and and these are largely healthcare workers, first responders, and whoever, again, has had the illness and recovered and tested positive. So these are often some workers, because those are the only ones that are actually being tested now, except I guess they're starting to open it up to the public. And what their goal is to isolate the antibodies from the plasma and then try to figure out a way to use the plasma to treat the most seriously ill with what usually the pulmonary components of this COVID-19. And again, I think it's that the healthcare community in Louisville has I think really done a very good job of kind of banding together. Norton's was helpful in working the what's the towers? What's the nursing home downtown here?
Trayton Oaks?
Trayton Oak Towers and finding a place to move those people out and they set up a ward, and I think it's not Brownsboro. I guess it's the St. Matthew's Children and Women's Hospital. I'm not sure, but anyhow, my point is that these different groups, instead of competing with each other, have really come together, and I think they deserve the credit and the appreciation of the community, for doing these things, and this is just a good example of how they're sharing this information, and hopefully something. And these are not the only groups that are in the process of studying this issue of trying to use antibodies derived from the plasma as a form of treatment.
Dr. Shively, can you talk a little bit about what's going on with rural healthcare centers in Kentucky to address some of this? I know that they're always on the brink of just keeping their doors open, and will need to devote probably a full show to the rural health hospital situation. But with regard to the pandemic, what are you hearing?
Well, in Kentucky, some people think that we're at risk. About 40% of our rural hospitals possibly closing. Before this epidemic, a lot of those hospitals were marginal, and now most of the hospitals are losing money. Now, we have had only a few cases of the coronavirus in Taylor County, but in Adair County, one of the nursing homes has had an epidemic, and I don't know the exact number as today, but there's, I think, between 30 and 40 patients who've been infected, and there's one healthcare provider, a nursing assistant, who died from the coronavirus.
Mercy.
And they have set up a COVID ward that's blocked off from the rest of the nursing home. Nursing homes are a really big problem. So rural health care could be in a very, very big problem, because we may have small communities that don't have a hospital, and that is a major problem.
Well, in that same vein, the healthcare workers, not just in this country, but around the world, have literally turned out in remarkable ways to fight this issue, and working in conditions where they're having to sanitize their masks. It's getting better now, because I think the supply lines are improving in terms of getting the kinds of personal protective equipment and things like that to the people that need them. But I mean, literally, they're out there on the front lines. The nurses, the doctors in the ICUs and the emergency rooms. I mean, these people are just heroes. And the EMS and the police and the fire department. I was listening to the radio and the other day, and they were interviewing an EMS worker from Brooklyn. And this fellow would get up and he'd start to work at 6:30 in the morning, and I guess he pushes a little button in his ambulance or and it says he's available. And they get a call and they go wherever they go. And he just described this, it must be an agonizing experience of going from one place to the other and basically just certifying people that had died at home. And in one case, he said it wasn't, they didn't really have to go through a lot of the kind of their protocol because this was somebody who had rigor mortis, and they've been dead so long that they were starting to stiffen up. My son is an F-18 pilot for the Navy, and he was deployed in 2019, and I'm immensely proud of him, to Afghanistan and Syria, and got hazardous duty pay. Now, Governor Cuomo has suggested, which I would entirely agree with it, that these healthcare workers get hazardous duty pay, especially the nurses, because the nurses are the ones, as Gene and I know well. I mean, we would come in and write some orders and wave at the patient or touch their abdomen or do whatever, change the dressing or something, and we leave. And the nurses are there for an 8-hour shift or a 10-hour shift, doing all of the direct contact things. Now they've got go through the dance of the protective equipment, come in and out of the room. It's incredibly difficult and incredibly stressful to have to go through all those things. Now, I doubt very much if anybody's going to get hazardous duty pay, but I sure think they deserve it.
Well, some of the volunteers in New York, nurses are getting paid quite a bit. I saw an advertisement on the internet for a nurse who volunteered to go to New York was getting $10,000 a week. So that's pretty good.
Well, that's
pay.
not. That's that's okay. That's good.
But, and let me just say from what you guys have said so far that it seems like we've had systems in place with the tabletop exercises. We've got scientists who are some of the best in the world. We've got healthcare workers that are some of the best in the world. And then we've got sewing circles to make masks and gowns for folks who are dealing with this situation.
Well, again, this is where we began this whole conversation, and with a central government that is asleep at the switch. For reasons that I don't quite understand, the president's son-in-law, who is a New York real estate developer, has in some way been put in charge of this supply chain that's supposed to be providing a lot of this stuff. I don't know if you remember General Russell Honore. He was an Army lieutenant general, I think, who was finally put in charge of dealing with the Katrina issues. The Bush administration had to put a guy who had something to do with horse farms. No, I mean, when you think about these things, what goes through people's brains, they put this guy in charge of FEMA. He had no more idea what to do than I would if in charge of something like that. But anyhow, Honore had took over and he ran the thing and because he knew about supply chains and because that's what the military does. I mean, if you want to send a bunch of people into the front lines, you better have some bullets and some food up there with them, or they're not going to do very well. And he made the observation about putting this guy Kushner in charge of this whole process of supplying these things, and basically, I think he got in front of a microphone, and this is not Honore, this is Kushner, and said, well, we're not here keep all the states busy, to supply them, they've got to work things out on their own. So you just wonder who's in charge, and that's the issue. We have a patchwork of issues in healthcare in this country that have go from Medicare with different options. We've got Medicaid that have to do with how rich you or how little money you have and what other disabilities you might have. You've got the VA system, which has got some of its own issues. You've got the military, the Army, Navy, and the Air Force have all got their own healthcare systems, and they actually work pretty well. And then you have somewhere between 900 to 1,000 for-profit health insurance companies whose main goal is not to provide health care, it's to make money. And you're absolutely right, Mark. There's no one in charge.
Dr. Shively?
Well, I have kind of a personal guilt about serving. I got a phone call from Samaritan's Purse. They've got a temporary hospital in Central Park and wanted to know if I was interested in serving. And I really wanted to, but, at my age, if I get put in a hospital on a ventilator, the death rate's about 90%.
Yeah, you're not coming out.
And so my wife wasn't too happy about this. And I've got 4 grandkids, so I elected not to do that, but I kind of feel guilty about not going. But I am on the list for the state of Kentucky, and I could do telemedicine and administrative duties, so if I get called, I'm going to do that. But I'm not sure I should be taking care of COVID-19 patients because it puts Mike and I at high risk.
Well, and we need both you guys for single payer radio, number one. But could we kind of pivot, and could you all talk a little bit about how vaccines are tested and come to market? So, because sometimes when you turn on the tube, there are some who are going to promote, well, we'll have this thing worked out in a couple months. So,
well, when we talked about doing this initially, one of the things I was concerned about was us getting out of our lanes, and I don't have any kind of epidemiologic or infectious disease background, and I would be very uncomfortable trying to get into it. I think something like that would be good to get a hold of Garrett Adams and get him in here and do a separate session on that. Gene, I'm not sure what your thoughts about it are, but I just don't think that's something I'm very comfortable getting into.
okay.
Well, I'm not an expert at that, but I did go back and look at some of the history of developing the polio vaccine,
Yes,
and
sir.
it was quite difficult. It took a long period of time. Vaccines are very difficult to develop, and it takes a long time to do it. First, you have to make sure that they're very safe, and that takes a lot of study, and it's going to take at least 18 months at the best. One of the things that's happened in America that's kind of sad is we don't realize why we live to 78. It's mainly because of control of infectious disease and vaccination and preventing diseases. Just look at all the diseases that we've essentially prevented. Over 100 years ago, the leading cause of death was TB. We've controlled smallpox. We've essentially wiped out smallpox around the world. We almost have polio wiped out. I think there's a few places in Pakistan and that there are a few cases of polio. If you're old enough to remember the polio epidemics, you couldn't go to the swimming pool in the 50s because there were polio. I have a friend who had polio. He was a brilliant guy, and he survived. You remember on Eastern Parkway, the Children's Hospital, that was essentially started for kids who are on the iron lung.
But is that the COSAIR?
Yeah, Coast
charity?
Children's Hospital. When I was a resident, we still had an iron lung at a general hospital. It was back in storage. I got it out one time. I had a patient that I couldn't control on a ventilator, so I tried using it. I had a lot of fun trying to figure it out.
How'd that work out?
It didn't work out too well, but it was a good idea, I think.
Well, listen,
Yes, sir.
maybe we could sort of, again, tilt a little off to the left or the right. And, one of the issues that's occurred with this coronavirus is that the loss of jobs has resulted in a lot of loss of health care. People, so it's according to the Commonwealth Fund, about half of the U.S. population gets its health insurance through its employer. And got a huge number of people who are out of work now, and if they've got some kind of company that's pretty good about maintaining that, that's one thing. But a lot of people aren't, and then they're left. They just go into the marketplace, and that's not a pretty sight.
It's estimated that 27 million people are out of work, and that approximately 40% of the people are going to lose their health insurance. Now, the states who've expanded Medicaid are going to be better off, and Kentucky's one of those states.
Yes.
The states who have not, they're going to have a large number of people who don't have any coverage.
Very alarming. Guys, we've got about 4 minutes, so I just want to give you a heads up on that.
Well, one of the issues, if you're no longer employed and no longer insured, is that you could go get some COBRA. And so this is very expensive. And according to the Kaiser Family Foundation, in 2019, if you were in that situation and you were a single individual, you would pay over $7,000 a year. If you have a family, it would be over $20,000 a year. So you've got somebody who was working in a grocery store who now getting their health insurance, and I'm not sure what grocery stores are paying, or you pick any job you want, and then you take their income away, and then expect them to come up with $20,000 a year for COBRA health insurance. They can't do it.
Well, we've seen the lines that can go on for miles with
Yes.
people just trying to get food. So, I mean, how feasible is this, Dr. Shively?
It's not feasible. Unfortunately, 78 to 80% of Americans live from paycheck to paycheck. So these people who lose their health insurance, they don't have any, they're not covered.
So the other option then is to try to get Medicaid.
Right.
And again, as you said, the states that have expanded their Medicaid coverage are in better shape than the ones that didn't. And then the other option is to try to get some low-cost health insurance. You can get a plan that's the monthly premium as low as $25 a month, which sounds good. You've got coverage. The problem is the benefits have limited, and if you get sick, they cancel the policy.
And there's no pre-existing coverage.
It's crazy.
Yeah,
And so, there's there are some real issues out there about the things that are going on in this country, and we've talked about this before, and I think one of the final statements that we agreed upon at the end of our last broadcast was that the best long-term option for a lot of these issues is some kind of single-payer system that exists in almost every other industrialized country in the world.
Dr. Flynn, I don't know if you had set this up, but I think that's a good point where we're going to wind down this episode, and for the next episode we could talk about access or rural health or both, just two really pressing issues here in our country. Thank you guys so much for coming in and sharing and the work that you all have done in the past and your advocacy for healthcare justice now. And let me say that the next episode of Single Payer Radio can be heard Wednesday, May the 13th at 2 p.m. That'll be with Dr. Barbara Casper, longtime doctor and School of Medicine faculty member, talks with activist Charlie Casper, yes, they are related, about practicing in our complex medical system. That episode will repeat Thursday, May 14th at 11 a.m. and Friday, May 15th at 1 p.m. Kentuckians for Single Payer Healthcare is suspending its regular meetings during the pandemic. We are meeting by Zoom, and you can learn more about the group and get involved by going to kyhealthcare.org or follow us on Facebook. And if it works for you, join us on Zoom. Let me see. To get a reminder about the program, sign up for our twice monthly news updates from KTILO. Go to kyhealthcare.org, and again, if you would like to hear if you like what you hear on Forward Radio, WFMP LP 106.5, please support our volunteer-driven community radio station. Go to forwardradio.org and become a member of our community. For Single Payer Radio, I'm Mark McKinley. Thanks for listening.